And welcome back. Thom Hartmann here with me, and pleased to have in the studio with me Charles Sauer, libertarian economist and president of the Market Institute. The website is marketinstitute.org. You can tweet Charles at Market Institute or at Charles Sauer, S-A-U-E-R. And Charles is spelled like Charles. Charles Sauer. Charles, welcome back.
Hey, thanks for having me.
So we've been talking today. We started out, back 2.5 hours ago or 2 hours ago, talking with Carl Higbie, who is a Donald Trump supporter. I'm not sure if he's an official surrogate or not, but basically trashing the Affordable Care Act. And that's kind of led into a conversation about Medicare and Medicaid and all this other kind of stuff. And I'm wondering, what is the libertarian solution to, and let me just identify the problem in my frame. You can reframe it if you want. We are the only developed country in the world where somebody can go bankrupt because they get sick. Number one. Number two, we take the time and money to make sure that our homes are safe from burning down, right? We pay for fire departments, but we don't do that with our bodies. If your body catches on fire, metaphorically, cancer, something like that, the fire department doesn't show up. In every other country in the world, you just go to the hospital, give them your magic number, and poof, it's all taken care of. So assuming that those are desirable goals, that people don't get wiped out by getting sick and that everybody has access to health care. And feel free to challenge that predicate. But based on that assumption, I don't see a libertarian solution to health care.
Well, I think that there's a couple of, let's not call them wrong assumptions, because our healthcare system is messed up. It's messed up with the Affordable Care Act. It was messed up before the Affordable Care Act, right?
Sure.
But what we do see is there's doctors, and I've talked about them before, but it's doctors in Oklahoma, there's doctors in Virginia, California, Ohio, and Florida that have broken out of the mold of what is broken about our system. And a lot of it has to do with government regulations and the way that insurance carriers, I mean, Blue Cross and Blue Shield is Medicare, right? They're the payers. They really do a lot of the performance of what Medicare does. But there's doctors in these places that are now listing cash prices, and the cash prices and the people that use those mostly are from self-insured employers. These cash prices are 20% of what the nonprofit hospitals are charging down the street. And so what we see is this market building of what the libertarian solution is.
So how does that help somebody who has 2 kids and works at McDonald's full time and is living on $18,000, $19,000, $20,000 a year, and literally has to decide this year for Christmas, are we going to have Christmas dinner or are we going to have presents for our kids? Why does it help them that the doctor down the street, when they get breast cancer, says, instead of the $100,000 I charge the insurance company for mastectomy, I'll just charge you $50,000?
What doesn't help that person at McDonald's is the Affordable Care Act. The Affordable Care Act forces that McDonald's employee not to have a mini med plan that provides first dollar coverage, not real insurance, but something to help them out.
But I'm asking, what's your solution? I acknowledge the existing system, including the Affordable Care Act, is not an optimal situation.
So under the libertarian
what are you going to do for that guy who's working at McDonald's trying to raise a family?
Under the libertarian solution, what we have is a company called Atlas MD in Kansas City. They're a concierge medicine, but they don't charge a high premium on top of your insurance. They charge a low premium and don't require you to have insurance with it. So they're charging for somebody my age with my family, or me as an individual, it'd be about $50 a month. My kids are actually down to like $20 a month with them, and my wife, who's a heavy user, might be $75 a month. We can call them up, tweet them, use Skype. Whenever we want to see them, they will see us. They also, because of the Kansas laws, can dispense medicine, and they're doing that at about 100th of the price of what the hospitals are charging. Now, that doesn't cover catastrophic care.
It doesn't even cover basic stuff because you're still paying for it. I mean, I get what you're talking. In fact, the only way I could get it, when we first moved to Washington, D.C., Louise has hypothyroid, she needs to take this medication every month or bad things happen. And we literally couldn't find a doctor that would see her within 3 months. And so we went to a concierge doctor. And so, you know, we pay a couple $1,000s a year, and she will call us. She'll take our call anytime. She responds to my emails. I can Skype her. There's never a charge for an office visit. I think concierge care is wonderful, but I'm a wealthy white guy.
The people in the Midwest aren't the wealthy white guys, right? They're farmers, and that's why I use Atlas MD. There's plenty of people that serve the liberal elite out here on the East Coast.
Who's going to serve the guy who's working at McDonald's or at Walmart? I mean,
if we go back out to this company in Kansas, the businesses that have used them have been able to decrease their healthcare cost over the past 10 years.
I shouldn't just specifically lay this on McDonald's, because I don't know if McDonald's offers health insurance to its employees or not. But let's say that you've got somebody who's working at an above minimum wage job, you know, 10, 15 bucks an hour, but it's still fairly low pay. They're trying to raise a family in America, and they don't have health insurance. And they're not going to start sending $50 every month to some guy in Kansas so they can talk to him on Skype.
So let's accept this statement and move to a different place then, and let's look at how people in Canada pay for medicine. Here's your McDonald's employee and Carl's Jr. employee, whatever your employee, your lower wage employee in Canada doesn't have the money still to pay for healthcare. So what do? They pay with time. And what do the people in Canada that can afford care do? They come down and visit Oklahoma and get their surgeries down there. There's actually a surgery center that just opened up, I believe, in Washington State, and now they're going there instead. So there's surgery centers all over the place. If you can afford to get out of that line, you afford to get out. People pay, whether it's a line or anything else. In Canada, they have one MRI machine for every 5 that we have here. They have one CT machine for every 2 we have here.
We figured out how to make them profitable. That's because, you know, we've got, you know, because we
can also see them in less than 6 months.
You know, I got an MRI in 4 days, you know, here in Washington, D.C. I mean, but you're going to pay for it. I mean, although I didn't pay for it, Medicare paid for it, which was an amazing thing. And because I've got single payer health insurance right now, and I'm loving it. No copay, no deductible, no nothing. I just show up, I say, here's my number, that's it.
It's not an amazing thing.
And it's been taken out of my paycheck since I was a teenager.
I actually spoke with a hospital administrator last night, and they charge for their MRIs $3,000. And that hospital administrator knows that you can walk down the street and pay cash and do it for $800. If it's being paid for you, if your bill's being paid, you don't care whether it's $3,000 or $800. I care because the bill's going to go to my kids. So when they're overpaying for your MRI, my kids are going to pay, and that's what the free market solves.
No, I understand all this conceptually, and you know, in an ideal world where everybody actually had enough income that they could afford to have a concierge doc, and in an ideal world where everybody, but that's not the world that we live in, Charles.
So your issue is a scale issue. If you set me up in a frame,
I'm not hearing a libertarian solution.
If you set me up in a frame that I have to go from this, which is a capitalist and socialist system crammed into one, which is the worst way you could do it, to a libertarian solution tomorrow, you're right. I'm always going to fail at that. But if you can stage it where you move it down, as we move to a system where you pay 20% less for an outpatient surgery, now my argument becomes at least closer, where then a doctor or a charity can afford that 20% of the surgery versus what they're overpaying for the $3,000 for the MRI now.
So without trying to rub your nose in this, it sounds to me like there isn't a libertarian solution that would fit, that would solve this for the entire country. There is one that would work for wealthy people, but I'm not hearing what are you going to do for poor people?
Well, that is untrue. Again, we've got farmers in Kansas that are getting covered right now where they weren't able to get covered under the current system. We have people that are covered under the system in Canada flying to Oklahoma to get coverage and get surgeries that they need right now. So I not to rub your nose in it, but I think that the solution is not just practical, but it's already happening, and soon it's going to take over the country.
Okay. All right. Charles Sauer, I'll leave you with the last word. Charles Sauer, libertarian economist and president of the Market Institute, marketinstitute.org. You can tweet him at Charles Sauer, S-A-U-E-R, or at Market Institute. Charles, thank you for coming by.
Thank you.
Great having you with us. We'll be right back.